Thank you so much for being here and providing us this big picture of what's going on in the country. Help us understand, is the issue that there just aren't enough of these supplies anywhere, and that we just can't get them to the right places right now?
Thanks, Megan. You shared a lot of the survey results. The challenge is this pandemic is virtually in every country in the world. And so all of us are having the challenges of getting enough capacity to serve the patients as they show themselves. And because Premier is the supply chain partner for thousands of providers, it's our job to really be figuring out how much supply they have on hand, how much they're using per day, where the cases are coming from. We're following the CDC mapping so that we know where the cases are emerging and concentrating. And our job is to try to help get the supplies to the right place at the right time.
Tell us about, if you can, a little bit of the regional distribution of the survey results you're seeing. Are the problems mainly concentrated in the hotspot areas like New York, Seattle, California, or are hospitals across the country concerned about this and facing these shortages?
So hospitals across the country are concerned about it. We actually surveyed and got responses from 1,000 hospitals representing lots of markets. Clearly, the New York market is in crisis, as is Washington State, California, but there are new emerging markets in Atlanta, New Orleans, and other places where the caseload is starting to increase. And in many of these markets, we're talking about cases that are doubling every 2, 3, or 4 days. And so from a Premier perspective, what we're trying to do in collaboration with FEMA and HHS and with manufacturers and distributors is really figure out where the demand is, where it's growing fastest, and how do we get those critical supplies like N95 masks, surgical gowns, isolation gowns, the hand sanitizer, the ventilators. There are hundreds of categories of supplies that are critical in combating this disease.
How much can some of these creative solutions that we're hearing about, alcohol companies making hand sanitizer, automakers making ventilators, and clothing companies making masks, how quickly could that potentially help, and how much could that help?
So Premier is getting lots and lots of inbound calls and conversations about various manufacturers taking on making some of those products. We are pushing the specifications to those manufacturers. We've got to make sure that these products end up being clinically effective. And there's a lot of gray market, black market, and a lot of price gouging. And so we're trying to be a clearinghouse so that we can help our health systems and we can help the market really understand if they're going to get quality product that will be useful and do it in a fair way. I would say of all the inbounds we're getting, maybe 10% of them legitimately can turn themselves into a solution. 90% of them may not be real, may have criminal elements, and so we're advising our health systems to be very careful about how they do that. The most important thing health systems can do, though, is follow all the conservation protocols. So you saw in our survey that 97% of them are following those protocols, which allow them to extend the supplies for a longer period of time.
Well, Susan DeVore, thank you so much for joining us. Important stuff you're telling us about, and some disturbing things with the criminal element you mentioned. We'd love to continue the conversation.